Disease overview. Signs and symptoms. X-linked Opitz Gbbb syndrome is a rare genetic disorder mainly characterized by facial differences, respiratory and genitourinary abnormalities as well as developmental delay or intellectual disabilities. Facial features may include widely spaced eyes, hypertelorism, a prominent forehead, widow's peak, broad nasal bridge, nostrils that are tipped forward, and cleft lip, palate. Respiratory abnormalities can include laryngo-esophageal clefts or the less severe laryngomalacia, soft larynx, that result in difficult swallowing and breathing. Congenital heart defects such as ventral septal defects and atrial septal defects might be present, as well as brain abnormalities such as agenesis, or hypoplasia of the brain region that connects the two hemispheres, corpus callosum, and hypoplasia of the cerebellum also in the context of more complex defects, such as Dandy-Walker malformation. Causes. The MID1 gene is the only gene known to be associated with X-linked Opitz Gbbb syndrome. Affected populations. The prevalence of X-linked Opitz Gbbb syndrome is estimated to be 1/50,000th to 1/100,000th males. Disorders with similar symptoms. Variants in the SPEC1L gene located on chromosome 22 have been reported in some patients with autosomal dominant Opitz syndrome, suggesting that this is a cause of this form of this disease. Kruska P. al. However, publications that reviewed the spectrum of characteristics associated with SPECC1L variants indicated that some clinical features specific to Opitz syndrome are not seen in patients with variants in the SPEC1L gene. Bo. E.J. al. FG syndrome type 1, FGS1, is an X-linked genetic disorder that is characterized by poor muscle tone, hypertonia, intellectual disability, constipation and/or anal anomalies and complete or partial absence of the part of the brain that connects the two hemispheres of the brain, corpus callosum. Other features of the disorder are small and simple ears, tall and prominent forehead, wide and flat thumbs and great toes and down slanting eyes. Craniofrontonasal dysplasia is a very rare inherited disorder characterized by differences of the head and face, craniofacial area, hands and feet and certain skeletal bones. In addition, the head may have an unusual shape due to premature closure of the fibrous joints, sutures, between certain bones in the skull. Coronal synostosis. Diagnosis. The diagnosis of Opitz Gbbb syndrome is usually suspected based on clinical findings. It is not possible to distinguish this condition from chromosome 22q11.2 deletion syndrome, autosomal dominant Opitz Gbbb syndrome, based on physical features alone. Treatment. Genetic counseling is recommended for affected individuals and their family members. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.